If your patient has a deep bite and you don't know what to do, you don't even know the direction, what device is used. Stop watching this video because today we are going to talk about deep bite in child patients, and I am going to tell you what no one has ever told you in your life. Stick around because that's how you're going to learn. Welcome everyone to another video on this channel. Here we talk a lot about interceptive and corrective orthodontics in a very scientific way. Today, I want to discuss deep bite with you because I don't know what happened, but we didn't have a video about deep bite in children on this channel until Diego told me, and I said, no, we need to make this happen for the love of God. It's a very common malocclusion. If you work with kids in your practice, or even if you don't yet but are interested and want to know more, you understand the importance of treating these patients. Plus, it's a great opportunity because there are few professionals doing this work, even among orthodontists. Many graduates don't treat children. So if you're just starting out in orthodontics, you're already on the right track with interceptive orthodontics, and this video is going to help you understand a bit more about deep bite in young patients. First of all, it's very important for you to know I'm going to start this video like this because there are a lot of people who don't talk about it, a lot of people who don't even know. But all the research has shown that is treating deep bite in corrective orthodontics more efficient than treating it in interceptive orthodontics.
What? I'm here in this video to learn about interceptive orthodontics, and you're telling me it's more efficient to treat with braces, right?
Yes. And I don't know the research from the doctor. What's his name? One moment. Doctor's research. Tiziano Buchelli has already confirmed that when comparing treatment in interceptive orthodontics and corrective orthodontics, it's more efficient to treat deep bite with braces. And here I want to bring up another truth that exists behind deep bite treatments. There are many doctors who recommend treating deep bite at ages 5, 6, or 7, but you need to know that deep bite in childhood is normal. It's normal. Why? Then, when the first permanent molars erupt, that's when you start to see the natural lift of the bite. So when the first permanent molars come in, I already have a little bit of bite lift. Then, when the second permanent molars come in, I have even more bite lift. So, deep bite improves with the natural development of the patient's dentition. And that's why, in many cases, we won't treat deep bite in children. Knowing interceptive orthodontics also means understanding the development of the dentition. It doesn't mean you're going to put braces on every kid just to avoid not getting results. So the patient who is a patient with good facial growth, who has a deep bite, but that does not affect the aesthetics of the patient, does not affect the patient's occlusion, mastication, quality of life, this child will not be elanted. This child will only be treated after they have all their teeth in place. After the eruption of the second molars, they will be treated when they have their permanent teeth. The thing is, there are exceptions to every rule. Does that mean we're never going to treat deep bite in kids? Of course not. Yes, there are situations where we will treat deep bite in children. Now you know. In normal situations, for patients with good growth, we won't treat deep bite. But, Professor Ray, what would be the clinical situations where I should do an interceptive orthodontic intervention? Should I put braces on a child patient for deep bite? And that's where we're going to talk about that. First of all, when the deep bite is so deep that it's causing discomfort in the patient's gums. It's even causing inflammation. The patient is chewing on their gums because of the deep bite being so deep. So in these cases, we treat because the recurring trauma to the patient's mucosa can lead to alterations in the mucosa, and it can have significant impacts. This inflammation can get worse. So we're going to treat when there are these indentations, when there are these discomforts inside the patient's mucosa. So that's the first clinical situation. The second clinical situation we treat. We treat deep biting teeth when the patient is already experiencing wear. The bite is so deep that the patient has worn down their lower incisors. So he might have daytime or nighttime grinding. So that's also a reason to treat when there's wear on prominent teeth. I'm not going to let my patient wear down their teeth. I have to treat them. And the third reason we treat is when the patient has a short skeletal face. And when this patient has such a short face that we can already see a reduced lower third lip compression and an extremely closed gonial angle with the jaw rotating counterclockwise. I see the synthesis. The part of the chin synthesis is really thick, really dense. These are the patients who have difficulty, who have limitations in the growth of the lower third of the face. And that is why we can also stimulate the lower third so that it has better growth. That when he is an old man, a gentleman in his aging, he will have a more favorable growth and a more favorable aging. So those would be the 3 indications for treating deep bite in children. Now, if you have a patient who falls into these 3 indications, then I'm going to recommend some devices that are interesting for treating deep bite. And there we're going to go over 3 devices. The first device I can recommend as a really interesting option for deep bite is the fixed anterior bite razor. So, this fixed anterior bite razor is a device where we usually place bands in the first molars. If you're treating for a very extreme reason, it can also be in the second deciduous molars. And we have an extension of an acrylic bite razor that goes from side to side, where you have a lift in the front region and leave the back section completely without occlusion. This device works like this for deciduous adhesion, mixed dentition. But it's much better. It's better indicated when we install it in the second transitional period of mixed dentition, meaning at the end of mixed dentition, because that's when the premolars start to erupt. The second device I want to recommend to you, which I even have here to show you.
A few moments later.
They would be the removable functional expanders. Here I have an Andres activator, which is my favorite propellant device. But we have the propellants to use for deep bite when the patient has the class 2 association with deep bite. So, it's an excellent device we can use to treat deep bite because I have wear on the acrylic and I have the passive eruption of those back teeth, flattening the curve and improving the overbite. And the third device that can be used for deep bite is our classic friend, dear, the 4x2, which would be the fixed appliance adapted for interceptive orthodontics. So, there are 4 brackets on the front teeth and 2 tubes on the back teeth. But how does overbite treatment work in this case? We use it in cases where the patient has very lingualized or palatinized incisors, very verticalized, and I end up using the 4x2 to protrude these incisors, and when you imagine that I have an overbite here, when I protrude the incisors, I improve the overbite, and this is common to be applied to patients with short faces. To the patients that I told you are extremely brachycephalic, this improvement in the closure of the interincisal angle is not the same. The protrusion of these incisors improves a lot. It's good. There is also an extra, a bonus that I am also going to tell you about, that it is not an appliance that I use that much, but it can also be used for overbite, which would be the trainers. So there are different types like smile braces, occlusal guides, and various kinds. I don't use them much because I work more with fixed appliances. That's my focus. But I do have a few cases where I treated deep bite with a trainer, and that's indicated when the patient has an equivalent smile and the incisors are extremely extruded. So, in this case, I need to intrude the upper and lower incisors, and then it can be used. Of all the traders that can be used, the brand I like the most is the occlusal guide. But you can also use other brands because the system is the same. What's the limitation? It's collaboration. The child has to wear it. It's not possible to talk with the trainer in. So, there are people who really like them. In my opinion, they're for very limited cases, extremely cooperative kids, and preferably families that have someone to keep an eye on the child to ensure you get the results. Okay. Among all these devices, there's an intense complexity in studying each of these protocols. The expanders, the 4x12, and inside the Intercept Diploma program, there's a module dedicated solely to teaching each of these protocol types. There's even a module that talks only about deep bite, explaining the action system of each of these devices. If you're planning to learn, master, and know exactly when to indicate one device or another, to study in depth the diagnosis and treatment plan for each of the kids in your practice, and maybe even for patients you don't have yet but will after studying. I am the coordinator of the Intercept Diploma, which is our program in preventive and interceptive orthodontics, where I teach everything from the basics to advanced protocols that will be indicated for these patients. If you want to know the information of the next group, because there are no places available for the next group right now, then put your name on the waiting list here. So, once we have the information about the next group, our team will get in touch. I hope you all really enjoyed the video. It's a cool video that you can put into practice. I often say things that are new to you and impactful, but I hope you liked it a lot. Leave a like, turn on notifications, and also share this video with other classmates, friends, colleagues. The teacher will be very happy. And leave a comment here about what information was most useful for you. I also want to know your opinion, okay? A big hug from the teacher, and I'll see you in the next video.